us again.
Today we're here to talk to Dr. Robert Spalding, owner and CEO of Beckett-Gland Learning Center. We have Erin Beckett-Gland here. She is the Vice President of the Advisory Board. Doc, we're going to start with you. What can a nail tech do to keep from having lawsuits?
Real simple. Follow protocols. Most people don't follow their own state protocols. In fact, 75% of most nail salons and nail techs do not follow existing protocols. I don't agree with all the protocols in the sense that they are a little weak. I think that the MediNail training gets you above those and it exceeds your training. And there's three things that tend to cause the most problem. And again, number one is failure to do even the basic safety disinfection protocols. Number two is aggressive services. Aggressive services would include something like working in something that's out of your scope of practice. Ingrown nails technically are out of your scope of practice if they're inflamed or painful or chronic, and there's any kinds of previous injuries, pus, or anything present that could put you in a harmful lawsuit situation. And remember, if you work out of your scope of practice, you may or may not be covered by your insurance. And the last thing is failure to follow the manufacturer's protocol guidelines. And that would include, say, your towel warmers being way too hot, delivering towels to people who are neuropathic or have poor vascular components to their metabolism, so that you can't wick away the heat. The other things that are in the third category would be manufacturers associated with chemical debridement agents being left on too long. So there's a lot of manufacturers' protocols you need to follow, the MSDS sheets that you need to follow, but those would be the three primary reasons for why we see infections in the salon based on 25 years of doing this, treating salon infections, and as well as being in over 20 lawsuits.
Erin, you own a salon.
I do.
And you have people working for you.
I do. I have a couple of
employees.
employees.
Walk us through, if you don't mind, what happens when a state inspector comes and how often and what do they look for and what you have to do or not do.
In our salon in the state of Tennessee, we get inspected once a year. And we have a checklist that they go through, and they are looking for specific things: dusty floors, nail clippings on the floors, covered surfaces. Are your towels in a labeled clean container? Are they your dirty towels in a soiled container that's covered? Is your trash labeled? Making sure that your license is up to date on in front where they're going to come and inspect you. They're going to walk around your salon. They're going to make sure that your disinfection protocol is following state board protocol. Now, in my particular salon, we exceed Tennessee state protocol, and we actually autoclave, steam pressure autoclave sterilize our tools. And we have an ultrasonic cleaner that we put our tools in to remove the physical debris with an enzymatic cleaner before we rinse those off, dry them off, and then put them in our autoclave pouches that have a color indicator that proves to our clients when we open them in front of them that they have been through a sterilization process. So we're going above and beyond state board protocol. We are making sure that we're using disposable files, buffer blocks, orange wood sticks, toe separators. Those things cannot be sterilized. And so we're using new tools per client to keep them safe. We're also not working aggressively. Since I have taken all of the training through Beckett-Gland Learning Center, I have implemented a lot of that education, and I'm passing that training and mentoring down to my nail techs because I want them to have a strong following and loyal following and build that clientele that's going to be knocking down their door to get to them. And they're going to have booked clients out for months and most likely a waiting list. People are starting to recognize the seriousness, and COVID was a key component time frame in people actually looking for safer services. And more people are discovering that they're coming down with type 2 diabetes. And this is a serious situation where a growing population of people are going to be needing safer care. People who are looking out for their health as a number one priority, not just sending them through an assembly line of services, manicures and pedicures. Not everybody gets the same care. Everybody needs individual care. So you're going to look at each and every client and find out what their needs are. And you may need to refer them to a medical professional before you can ever work on them. You may have to turn away that client, and that's okay. They're going to thank you for that in the future and come back to you again and again and refer you to other people who are searching for people. So this is not only just for safety purposes, but this is actually going to improve the integrity of your business. It's going to build your community recognition of what you're doing. It's going to be able to get you to have podiatry and dermatology and the medical community to respect you and build a referral relationship. So taking these MediNail courses is not just about practicing safer, but it's also going to build your business stronger and better than ever.
Dr. Spalding, you have been involved as a consultant for several lawsuits. Is that correct?
Correct.
What is the main, I don't know exactly how to ask this, but what is the main thing that you have found in consulting in these lawsuits that nail techs need to be aware of so that they don't get involved in one?
Well, I mentioned earlier 3 components of what most lawsuits, but it all boils down to infections. Infections that are breaking the skin. And every service you do, whether you realize it or not, creates what's called Salon microtrauma. So that means even just lightly buffering in the corner. If you do it too long and get too hot in just with an emery board, that's enough to break the surface of the skin and allow bacteria to get in it. Because where do all the bacteria lie? It's on the outside of the skin. So anything that breaks that integrity of the skin gives you a portal of infection. And that can occur through chemical agents or services that you use that are aggressive. If you're in there trying to get out compacted debris, now you're going from aesthetic care into routine foot care. And technically, routine foot care is not the scope of practice of a nail tech unless they're under the direction of a physician, and that requires training. So the MediNail training is broken up into 3 sections where you end up getting basic training where you learn to autoclave, as Erin referred to earlier. There's many steps to that, learning that process. Then you want to work aseptically so that you're working with gloves. And unfortunately, it took COVID to bring gloves back into service. And now that COVID's wearing off, people are starting to go back to hand services without protections of gloves. And the last thing in the basic advanced nail technicians course is referral. There's a process on sending referrals to physicians and receiving referrals from physicians. For those who want to work with a physician, we have the medical nail technicians course, which I came up with around 1998 and started lecturing on this, and then it's included in my book, Death by Pedicure. For those who want experience beyond just what cosmetic foot care is for the nail salons, which are authorized and designated by the state cosmetology boards, you can start working with physicians, and that would be working under their license. There is really no such thing as a licensed medical nail technician. People feel like that this course or other courses that have tried to do the same are licensed. They're not. It's a certification that you learn this information.
Erin, what happens when a client comes into your salon and they're injured? What do you do?
Accidents always happen. We nail techs are not infallible. So if an accident happens and we accidentally cut somebody, we accidentally overfile some skin, and we create an injury, we as nail techs need to, first of all, we need to address it. We need to physically say to the client, I have injured you, I have broken your skin, so that they are aware as well as you've acknowledged it. Second thing you need to do is you need to follow your state board protocol, and most state boards have a blood spill kit protocol where you have to have supplies on hand to take care of said cut. And that's just addressing basic injury protocol. So you're going to clean that wound, you're going to dry it, and then you're going to apply an antibiotic ointment, and then you're going to apply a bandage, and you're going to let that client know and have them fill out a waiver form that explicitly explains that they have been injured in their service and we're concerned about this. We want to make sure that they walk away and know that we are aware of what we've done. We are going to make sure that we're going to address it from our end, and that they are to be aware of signs and symptoms to look for if this thing gets worse. They need to see their medical professional, especially if they're type 2 diabetes, or if they have any vascular compromise. This is something that needs to be addressed immediately. A lot of people take things for granted. They think a minor cut's no big deal. They've had a paper cut before. It'll heal over. It's no big deal. Unfortunately, we have seen all too many times a simple wound, a simple blister can escalate into severe tissue damage. And so then you're going to refer them over to a medical professional. And when you do that, Dr. Spalding can tell you where it goes from there.
A lot of times, unfortunately, going back to what Erin just said, that these nail techs try to hide the injury, or they try to pretend it's not serious. They'll do something pretty stupid, like sticking it back into the dirty water. One of the things you've got to do, the first and foremost, is to acknowledge there's an injury. And we've put one of these forms, an accidental injury waiver, into our training, both in the A&T and in the master's program, the MediNail master's program, that has a little bit more detail on this. But again, you want to make sure you follow what you were trained in school to do. But in case you weren't trained well, or you forgot that section, the first thing is that you want to clean that wound with fresh water. That's the first thing you want to do. And you don't want to use dirty, soapy water. You want to use fresh, clean water to clean the wound. And this, of course, assuming you've already acknowledged that there was an injury in this situation. The injury waiver protocol was designed so that even though it was a simple injury that you may not even have seen any blood, you may have just recognized that she withdrew her foot or hand while a service was being provided, and all of a sudden she said there was a little pain. If there's pain and there looks like the possibility of an injury, after you've cleaned this injury with fresh water, one of the products that I have used now after 25 years of doing it, we want to make sure that we use an antiseptic that also has some properties of being a disinfectant. And one of those unique properties is not necessarily alcohol, because that would sting, but something called hypochlorous acid. That is what I have found to be one of the best tools for you, not only after you provide your services, just to be sure, but this hypochlorous acid is one of the strongest antiseptics that is also sporicidal as a disinfectant. So it has dual purposes that none of these other products have that you've looked at in the past. The next thing is that it's going to vary from state to state and from doctor to doctor, but I always encourage them to use some type of first aid ointment, whether it's polysporin, neosporin, bacitracin, any of the types of petroleum product. Now, some people with a rare sulfa allergy sometimes can't use certain products. So for the most part, you want to put a good antibiotic, topical antibiotic, and send them as per your waiver, send them and suggest they either see their primary care doctor or they see the ER if it's serious enough, especially if they're high risk and they have vascular problems or neuropathic problems. If they're diabetics with all of these problems, then those are the people you definitely want to make sure that they're aware. Now, they may refuse to sign the waiver, but at least you put down on the waiver, they refuse to sign. So that means you have record that this is something that is documented, so that in the event that it did go to a lawsuit, you made an attempt to try to get them help. Now, they can refuse it on their own, or if it starts getting read later, that's on them. Now, this is not like Monopoly where you get a pass, $200 pass go. This is a get out of jail free card, but it helps document that a situation like that happened, and that's the most important thing at the beginning stage. I think people will come to respect you, that you were concerned enough to do this. You may lose a client, but at least you don't gain a lawsuit.
Is there anything else either one of you would like to say before we end the videos?
Well, the problem is you're going to need this extra training, because this is not available in any of the cosmetology books that you were trained on, be it Pivot Point or be it Milady. So those are not necessarily going to be part of your training in that. Like we said earlier, MediNail is all about exceeding state regulations so that you can avoid lawsuits. Now, you can work behind the scenes and do all these things that are out of your scope of practice, and you may get by with it for a while. But ultimately, someone down the road gets an infection, and whether you get a lawsuit or even them telling this cosmetology board it happens, it brings you bad press behind the scenes. So you just need to practice ethically and with the most information that you can get as far as your education.
I'd like to also add that, social media being everywhere and very instantaneous, people are quick to post on Facebook or Instagram or TikTok or whatever that they've been injured in a nail salon. And they'll name the nail salon and they'll video and take pictures of what happened to them. And that's your salon's reputation. Is that the reputation risk you want to take? Unfortunately, people's first instinct isn't to contact their state board if they're concerned about infection in a nail salon. The consumer doesn't know who governs our licenses. So the first step they take is they go to social media. People believe social media like it is fact and hard fact. So be careful. Do you want to be on social media? Do you want to have that reputation where you cut somebody and it turned into a paronychia and now it's full of pus and it's got to go to the doctor? That $25 pedicure now just cost you an urgent care visit, antibiotics, potentially surgery down the road. Who knows? That's not a risk I would want my client to take when they're sitting in my chair. So just be very cautious and make sure that you keep yourself safe and make sure you can practice your career years into the future and have a clientele that's strong.
Excellent. That's what I would promote.
Baby.